How can you utilize telehealth right now when we're under quarantine, when we're stuck at home? You can still access telemedicine services of all of the fertility specialists to plan your cycle, plan your path to parenthood, understand your options, first consults, second opinion consults, follow-ups with your provider. How can we use telemedicine for fertility? I mean, everybody's stuck at home. Now is the exact perfect time to connect with your specialist for a first consult,
Yes.
for a follow-up consult, for planning consult.
Yes.
So let's break down each one. First of all, how do you feel about this shift in the American healthcare system?
I think it's about time, and I think this is the maybe a little positive light in this in part of this crisis, which obviously has everybody stressed out, is that it's forcing healthcare providers and the healthcare system to utilize technology to keep people safe. Literally, the more isolated you are, the better it is, the lower your risk. So wash your hands, social distancing, don't touch your face, and don't travel to high risk areas. So those are the big things. If you can do those things, you can stay safe. And a lot of medicine is about advice. A lot of fertility is about advice. Sometimes we have to do procedures. Sometimes we have to do an egg retrieval or an embryo transfer and artificial insemination. And those, we haven't figured out how to do those remotely yet, but we're working on it. But a lot of it is about, like, what are your test results? What are your options? What are the risks? What are the benefits? What are the things you can do to be healthier? What are the things you can do to increase your chances of getting pregnant? And a tremendous number of people actually that seek fertility care, a lot of them actually will get pregnant with just some good advice. And so we are seeing that our healthcare system, the vast majority of doctors today, are really still just using the phone, using in-person visits, using the fax machine. And
The actual
I
machine.
know.
Not even the fax, the actual machine still exists.
Yeah, I don't really like the fax machine. So it's this is a call to action, and I think it's gonna push the healthcare industry forward to become more commensurate with other industries like finance and things like that that are technologically very, very savvy. Now, having said that, it's not just that doctors are all fuddy-duddies, okay? There are a lot of doctors that are technically savvy, but we have tremendous amount of regulatory. So your doctor has FaceTime on their phone, but they are not allowed to talk with you officially via FaceTime. FaceTime is not HIPAA compliant. And my understanding is Skype is not HIPAA compliant either. So you need to have something that fits the HIPAA rules, which is protecting your privacy. Like, you don't want your medical and private medical information all over the internet and out in public. And I understand MedAnswers is coming up with a solution soon.
We're close. So what you can currently do on the MedAnswers Fertility Answers platform is you can request a consult from Serena. We have a new flow that's coming out. This is a huge product improvement. We do have the capability coming, though, where you can complete your actual visit via the phone. You don't have to see each other if people don't like to be on video. There's a lot of people in this country who do not want to be on video.
Oh, yeah. Can just be by phone. Yeah.
Just do audio.
Yeah.
And it'll all be through the platform. What can people expect? Let's take it chunk by chunk real quick. Not that that's an awesome word, but if it's a first consult, how long should that telehealth consult be? Is 30 minutes a long enough first consult with you?
I think 30 minutes is good. The other day I had a couple that had a tremendous number of questions and I did 90 minutes. I'd say that's much longer than my average. Most of mine are somewhere between 30 to 60 minutes. And usually we like to block out 60-minute time blocks because we don't usually spend all that time on the phone, but sometimes, like, connectivity issues, somebody's running a little bit late,
right?
You know, like,
and
sometimes
your notes, you have to make sure you get your notes into their record, right?
Yeah, exactly.
Okay, now before you do a consult, do they have to fill out all the forms and everything before you do a consult?
That's what we do. The more information I get ahead of time, the better. And because then I can load it onto your electronic medical record. And while we're talking, I can pull things up. And for you to have your own paper records right in front of you, I find is also super helpful. But, you know, the thing is, if you don't have all your records, don't stress about it. Like,
Don't
it's,
delay the appointment.
yeah,
Still take the appointment, because so much of this fertility journey is step by step by step. And we
Yeah.
don't want any one thing to be a blocker. We don't
Right.
want anything to delay it any further, because you might say, I don't even need that record, that
Exactly.
record anymore. I need to go get a fresh one for you.
Right.
Whether it's data or a scan or a.
And I think that's a great point, Alice. Is one of the biggest issues we have in terms of fertility is, like, if we can connect with somebody and we collaborate with them and move forward with them for treatment, most people have a very good chance of success. The issue is a lot of people who need help are just not even making that first connection.
Right.
That's a huge barrier, so.
Exactly. And look, if cycles start getting delayed because clinics have to go on pause until COVID is over, you guys will have availability. And we want to make sure that our users and our audience know now is a perfect time to start scheduling those consults, especially telehealth ones, because then when it comes time to having the in-person consult, you're 3/4 of the way there.
Yes.
You're 3/4 of the way knowing what the plan probably will be. And there's a couple of in-person check boxes that'll get, checked off, like an HSG, or just, your last follicular scan before, starting your treatment. But you could get medications right now. You could get,
and a lot of programs want you to take your IVF class or your IUI class ahead of time. And that's like a full 1 to 2 hours of online teaching or video classes for a lot of people. And I find that, like, I can't get started until you take your class, because then you can't sign your consent forms. A lot of stuff can be done virtually, a lot of the preparation for treatment. But Alice, I have a question for you.
You do?
How many doctors right now are on the MedAnswers platform in the United States and then throughout the world?
So we have about, we have over 330 fertility experts. I would say probably 60 to 70% of our doctors. So we have a lot. We have enough to be doing telehealth consults. Yeah.
That's awesome. So all over the country.
All over the country, and in Spain.
Okay.
We have partners in Spain for medical tourism. If people need a different time zone, they have Spain. We also have Mexico. We've handpicked really prestigious clinics across the world for people who do want to take advantage of medical tourism. And we just have phenomenal physicians that are sprinkled across the country. We've got plenty of people to request a consult from in Canada. Don't forget our friends in Canada. Yes. So
cool.
We do. And I mean, that's our Monday motivation today, is that we get that this is a scary time. We get that it feels like everything's on pause, but it doesn't have to be for your fertility journey. You have all these providers that can do first consults, second consults. They can do second opinion consults while you're stuck at home, hopefully enjoying your time with your partner, while we do social distancing. And it can be an incredibly efficient process. So get in the app, request a consult, or pick up the phone and call the clinic or send them an email so you can get connected today.
Yes.
That's right. We'll make it happen. This has been your Monday Motivation with Alice Crisci, creator of the Fertility Answers app, and my dear friend and colleague, Dr. Serena H. Chen. Stay safe, stay away. We got this. We will get through it. Wash those hands, and we'll come back next week, same time, same place, and hopefully we'll start to see COVID behind us at that point. All right, everybody, take good care.
Stay healthy. Stay healthy.
Bye.
Bye.